Ambulance Tasmania is at the front of Tasmania's emergency response. But in December 2016, it found itself at the centre of one. One of its own, Damien Crump, took his own life. An inquest heard many colleagues were aware of his mental health issues and plan, but feared raising them with Ambulance Tasmania. His manager, who considered him a friend, also suspected he'd been stealing drugs from the organisation. But his name wasn't provided to police, and Ambulance Tasmania didn't conduct its own investigation. When Mr Crump was finally caught at headquarters, he stole more drugs and enacted his plan. In her investigation into his death, Coroner Olivia McTaggart said it wasn't the fault of individuals, but the shortfalls of the organisation that meant they couldn't fulfil their jobs properly, highlighting severe resourcing deficits in the organisation, inadequate management of staff, and a culture of tolerating unacceptable behaviour. The coroner saying these factors substantially contributed to Mr Crump's behaviour and welfare not being dealt with, and his drug thefts being undetected. Coroner McTaggart said the evidence from paramedics throughout the inquest painted a picture of an almost intolerable level of workplace stress. She also said its degree of cooperation with the investigation was markedly poor. She made 13 recommendations, including that Ambulance Tasmania introduce random drug and alcohol testing, regularly review managers' duties, introduce mandatory psychological assessments, train staff on drug handling policies, and publish the progress of a cultural review.
And we've made very significant changes as a result of Damien's death and the learnings from his death. And we'll continue to make those changes to ensure our organisation is safe.
Ambulance Tasmania says it will be assessing the recommendations over coming days. Lucy MacDonald, ABC News.